Hello, 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 YouTube world. It's Miss Patti with For Your CNA, here with our live weekly question and answer session, where I answer all of your questions regarding CNA training and testing and workplace and whatever else you want to talk about. I welcome you to the show. If you're brand new, if you're just joining us, make sure that you send me a hello or a hi or a wave in the chat so I know you're here. And we're going to have a little brief lesson before I get into your questions. That way you can get in, kind of get settled, and have a conversation with others if you wish. And then we'll get to your questions in just a little bit. So exciting to see everybody here. Looks like we've got quite a few on. Hi, Joseph, Louis, Jean Marie, Carmel. Hello, Brown Mama. And hi, Kathy Ann. Welcome back. So today, the lesson I want to talk about is about supplies. And this kind of came up in, we graduated a class out yesterday. So congratulations to all the people that graduated from my classroom training program yesterday. And if you have a chance, we live stream our classes every class session. So you are more than welcome to join in to one of my classroom live streams. We go live every Monday and Wednesday from 9 to 1 Eastern, and we're here on YouTube. So feel free to join in if you want to. But congratulations to all of my classroom students that graduated out yesterday, and we wish you great success on the test and in your career. But this topic kind of came up a little bit, and it got me thinking that this is probably something I want to talk about on a weekly lesson because it's not something I've really covered much before now. So I want to talk to you about supplies, but specifically about linen rules when it comes to supplies. Now, something that always trips students up when they're getting ready for the test is, do I have to get all of the right supplies? You know, what if I forget a washcloth? Or what if, I'm hoping you guys can hear me. Can somebody please send me a chat, let me know if you can hear me or not. Here I am just talking away, and I'm hoping you guys can hear me. So the question is, what if I forget something? And I'm doing the skill and I don't have what I need? Is that an automatic fail? And the answer is no. There's no checkpoint that says got the right number of supplies. It doesn't work like that. You're not really graded on the supplies that you get, but you are graded on what you do or don't do with those supplies. And when I say that, people kind of, their minds kind of go to, oh, okay, well, if I don't have enough washcloths, then I can't wash and rinse. So that makes sense. But it actually goes beyond that as well. When I'm talking about what you do and don't do with your supplies, I'm actually talking about what you do with the supplies that you do gather as well. And that's what today's lesson is going to be about. But to go back to that topic really quickly, if you don't get enough supplies that you need to do the skill, you can just go back and get what you need. But, and there's a huge but here, so time out. You can't just walk up to your clean supply shelf with dirty hands or dirty gloves. So if your hands or gloves have touched anything other than clean supplies, you've got to stop, remove your gloves if you're wearing them, go wash your hands, and then go get what you need. If you go to the supply shelf and reach in to get something that you forgot, or the patient's bedside cabinet and open the drawer to get something you forgot to get, then that is an infection control problem because you're reaching in there with hands that aren't clean and you're contaminating other areas in, this clean supply shelf or the drawer with your dirty hands. So that's what they're going to be grading on. It's not the fact that you forgot a washcloth or a pillowcase or a toothbrush or whatever the case may be. It's not the fact that you forgot that. It's what you're going to do when you have to go back and re-get that supply. Are you cross-contaminating? That's what they're going to look at. So there's no checkpoint that says got the right amount of supplies. You're graded on what you're going to do with those supplies. And on that note, let's kind of get into today's lesson. So those of you who had followed me, if you've watched my classroom program, if you've taken my online program, you know that principles-based instruction is what I'm all about. So I created this system, and we have puzzle pieces that we use for commonly used steps that are seen over multiple skills. And Linen Rules is one of those. So Linen Rules is going to apply if we're gathering any clean supplies. So this applies to pretty much almost all the skills. If you're getting supplies, you have to know what to do with those supplies to not contaminate them. And that's where Linen Rules comes in. Now, I talk about this in my classroom program all the time, and it's in my online program. But for those of you who are currently practicing that maybe don't know this or haven't heard this, this might be new to you. And it's super, super important. So let's kind of talk about Linen Rules, okay? So there's a couple of rules. If you're going to get supplies, and it doesn't matter what, we're calling them linen rules, but it actually is supply rules. It doesn't matter what supplies you're getting. You've got to be careful not to let them touch your uniform. And this is the one that I'm going to spend the most amount of time talking about in this lesson. But I want to just really briefly go through the rest of this list too. We're going to come back to this first one because that's what I'm going to be talking about today. But we have to have clean hands to get our clean supplies. Now that makes sense, right? You don't want to be handling any supplies at all if your hands are not clean. So we're going to do our opening, knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close the curtain. And because we've touched that curtain, we're going to go wash our hands. Now there's a checkpoint that says, did the candidate touch the patient before washing their hands? That's a very, very big deficiency. You cannot touch a patient until you've washed your hands. But that curtain isn't clean, is it? So a lot of people touch that curtain. So we're going to do our opening, close the curtain, and then go wash our hands. Now, once we've washed our hands, this is when we're going to go get our supplies. So there's a checkpoint that says, you know, that refrain from getting supplies until after hands are washed. So we have to keep that in mind. We can't get supplies until we have clean hands. We don't want to shake or snap the linens because that just aerosolizes any yeast, dead skin cells, bacteria, anything like that from your surface right up into your breathing zone. So you don't want to snap or shake linens or, you know, any other supplies, linen-like supplies. You want to remember, and if you watch my classroom program, this is going to make sense to you, but clean rolls toward me, dirty rolls away. And this is kind of the little memory mnemonic that we use when we're putting clean linens on and taking dirty linens off a surface. So clean rolls toward me, dirty rolls away. And I'll do a lesson on that later. If you've watched my classroom program, we get into that quite a bit. I've got a whole lesson on it in the online program as well. We don't want clean or dirty linens to touch the floor. And this is actually a really big deal, way bigger than most people realize on the checklist. You definitely don't want linens on the floor. Clean linens can get contaminated by pathogens that are on the floor before you put it on the bed. You don't want to do that. But you also don't want to grossly contaminate the floor with dirty linens either. And we'll go over that in another lesson in, you know, sometime in the future as well. And then you've got the last one, which is one that most people don't know. Anything that you take, you have to use. If you don't use it, you're going to discard it. So any linens that are unused are still going to go in the dirty linen hamper. You cannot leave them in the room for later. Once things are out of your sight, you cannot consider them clean. Somebody may come along and sit on those linens because they're on the bedside chair. Or a family member may spill coffee on the floor and look around and they see a washcloth, so they pick it up and they wipe the coffee up. But there's no hampers in the room, right? We don't keep dirty linen in a clean patient environment. So there's nowhere to put this dirty washcloth. So family members might just fold it up and put it right back where they found it. You cannot consider anything that's out of your sight in a patient environment clean because you have no idea what's happened to it, who's touched it, what's been done with it. It just can't be considered clean. So the rule is take what you need, but use what you take. Anything you don't use, discard, right? Take what you need, but use what you take. And if you don't use it, you're going to discard it. So those are our linen rules. Now, the one that I really want to focus on today, though, is the first one. And this one is linens must not touch your uniform. Now, your uniform is not considered clean once you start working. And because you've pressed up against the bed, the curtain has hit it. Remember, the curtain is not clean. You've leaned against the sink. You've knelt on the floor to do foot care or empty the drainage bag. Your uniform is not considered clean. So you don't want to hold clean items right up next to your uniform. So when you're getting supplies, you actually have to hold them out away from you. And that means that if you're gathering pillows for sideline position, if you're getting linens to change the bed, if you're getting washcloths and towels to do a bathing skill, I mean that all of the skills require some sort of, well, not all of the skills, I'm sorry. Most of the skills require some sort of supplies. You won't have anything for range of motion, transferring a patient, ambulating a patient, those types of things. But everything else is going to require some sort of supplies, and you don't want those supplies up against your uniform. Now, this is so important, and I pulled out several checklists here to show you this. This is actually on the graded checklist, and you see the same checkpoint on all of these. Now, this isn't all of them. I just pulled out a few to show you just how important this is. But here, partial bed bath. We have denture care. We have dressing a resident. We have foot care. We have occupied bed, and it goes on and on. But all of them have the same checkpoint, and the checkpoint reads, avoid holding clean or dirty linens against clothing. Every single one of these has that same checkpoint, and that's why it has become a principle. So these principles are actually checkpoints that show up on more than one skill. And because we're doing it over and over and the rule always applies, we put it in a principle and we call it a rule. And that's what this is. This is a rule that has to be followed because there's a checkpoint that it associates with. Does that make sense? There's a checkpoint there. But it goes beyond that. And this is probably the one thing I really want to get across to you, is that it's not just about the checkpoints. That's kind of what we focus on, isn't it, when we're going to take the test, right? What do I have to pass? I want to pass my test on the first try. I want to get certified. I want to get out there working as a CNA, and those are all great goals, and I absolutely agree with you, and I'm here to help you in any way that I can. But that's not the end of the story. We focus on the test because that's what's standing in our way. But we have to understand that this rule is way more important than just the test. And unfortunately, what ends up happening is that people memorize this for the test, they learn how to do the skills, they get out there in a clinical setting, and all of these things go right out of their brain, and they do things the way that they want to. They kind of work into their own routine, right? This is one of those things that you should not change. It's not just for the test, and let me explain why. There's something called a healthcare acquired infection, or HAI. Now, we used to have a different term for this. It used to be called a nosocomial infection, and man, that is a mouthful. A nosocomial infection. Well, they changed it to be a healthcare acquired infection. Now, what does that mean? I mean, those are really big words. What does it even mean? Well, it means that when you are in a healthcare setting as a patient, now remember, you can't just call up your local hospital and make a reservation. Hey, I need a break. I'd like to reserve a room. It doesn't work like that, right? In order to get into a healthcare setting, you got to prove that you're sick enough to actually need that space, because there's a whole bunch of other sick people that want it too. So you've got to prove you're sick enough to be there, which means that we take the sickest people in our community and we put them all under one roof. That's scary, guys, right? The sickest people. It's like we go out and we round up all of the pathogens and we put them all in one place. Now, you and I, we have good working immune systems, right? We're healthy, we're active. You know, you've got good working immune systems. You're not sick at the moment. You're not fighting something off. Because when you are sick, your immune system is busy trying to get rid of whatever's making you sick, whether it's an illness or an injury or an aging process. Your immune system is super, super busy right now. It's fighting a war. Now, we put that patient whose immune system is super, super busy fighting a war in a setting with lots of other pathogens. Now, this isn't a one pathogen at a time situation. Because that patient whose immune system is busy is in a healthcare setting, they are at risk because they don't really have the resources to fight off something else. Now, those patients usually don't wander around room to room. When you've got a patient, they usually kind of stick to themselves, right? They're either in their hospital bed or they're they may be in a dining room or an activity room, but they're not, they're not cuddling up with each other. They're not touching each other. They're not transferring pathogens back and forth. Where this becomes a problem is us, because we are going in and out of patients' rooms and we are touching patients' portals of exit. Now, if you don't know what a portal of exit is, that's going to be my next lesson for next week. We're going to talk about the chain of infection. So tune in next week to learn more about that. But what a portal of infection is any break in the skin or any wet body opening that can allow pathogens to exit the body. Well, as CNAs, we work with these all the time. We're doing, we're bathing and grooming patients, so we're up in their face. And guys, most of your portals of exit are on your face. We're also helping patients with pericare and bedpans and bathroom needs. So those are other portals of exit. So as CNAs, man, we are all up in everybody's business, and that means that we have access to whatever is coming out of that patient. Now, if we're not super careful and we're holding linens against our uniform, soiled ones, then those pathogens are now being transferred to our clothing. And then we go into the next room and we get clean linens and hold those up against our uniform. And now we're transferring those pathogens from our uniform onto the clean. And unfortunately, this is a very, very common method of transmission of pathogens from one patient to another in a clinical setting. And it all has to do with our habits, because as CNAs, we are the direct care providers. We're all up in our patient's business. And because of that, we have a much greater risk of transferring pathogens from one patient to another if we're not super careful here. And that's where this particular rule comes in. That's why this rule is so important. When we talk about linen rules, knowing that linens must not touch our uniform, this is, one of the most important rules that we have to abide by. And it really doesn't have anything to do with the test. It has to do with the reduction of transmission of pathogens from one patient to another because of our habits and actions as direct caregivers. Guys, we're the ones that give patients pathogens that they didn't come in with way more than any other staff member. This can be traced back to CNAs more times than not. So while this seems like a very arbitrary rule, don't hold stuff up against your uniform. And your instructor may, even say that to you. Don't let that pillow touch your uniform. And, it kind of goes in one ear and out the other. And you're like, yeah, whatever. I'll remember for the test. But it's way more important than just the test. And we kind of have to understand that there's a reason behind this that is way bigger than we realize. Because we're the only thing standing between that pathogen and the patient. Now, let's talk about that for a second. So let's say that we get this all wrong and we transmit a pathogen from one patient to another. Well, that patient, because they're so busy fighting another war, right? Their immune system is super occupied at the moment. They may not have the resources to be able to fight off that second infection, or because the immune system is going to be split between two infections now, that initial problem may not get the attention it needs from the immune system. So when we have patients that we introduce a new infection to in a clinical setting, the mortality rate goes up dramatically. And that's because we're either taking resources away from the primary problem, or all of the resources are attacking that primary problem and there's nothing left to address the newcomer, the new pathogen. This is a huge issue. Can you imagine for a second? Let's say that you have a car accident and you're in pretty bad shape and you have to go into the hospital. And you're in the hospital for a couple of days, but while you're in there, one of the direct caregivers that's helping you with the things you need help with because you've been in a horrible accident and you've got broken bones and issues and whatever else happened, whatever you're there for. Can you imagine if one of your caregivers gives you C. diff on top of that? Now, C. diff, for those of you who don't know, is an intestinal infection that results in horrible profuse diarrhea, and it's extremely hard to get rid of, but it can result in dehydration and serious complications, and in some cases it can even affect your internal organs, your whole digestive system. It can be very, very detrimental. And so you survive the car accident and you're getting treated for it, but you get C. diff and it kills you. I mean, how horrible would that be? The car accident is bad enough, but then you get this other thing over here and that's what ends up doing you in. And it didn't have to, because you caught that thing, whatever that thing was, from somebody that was trying to help you. So we have to be aware that help isn't help if it's not helping. And we have to minimize the risk to the patients that we're working with by minimizing the external infections or pathogens that we are working around. And that's why this rule becomes super important. Now, I could talk to you way, way, way more about hand washing and the importance of that. And we'll get into that someday. But all of you guys should know the importance of hand washing by now. But it goes beyond hand washing. And we have to remember that preventing the spread of infection from patient to patient is our number one task as a direct care provider. Number one. There is no task that we do that is more important than that. You can give the bed bath of the year, right? You can provide mouth care like nobody's business. You can ambulate patients from here to Timbuktu perfectly. But that makes absolutely no difference at all if we're allowing pathogens to go from one patient to another, and that's complicating their recovery, right? So the tasks that we learn to do, they actually are not nearly as important as preventing the spread of pathogens to our patients. So, performing tasks, that's a good work, that's a good thing, but it's not good if we provide complications to the patient while we're doing that good thing. I hope that helps. I hope that makes sense. So let's see who's here. we're going to get to your questions. So let's see here. S&M, hello. Jackie says, hey, stranger, you helped me pass nearly 2 years ago this July. Congratulations. That's awesome. I love hearing from past, I'm going to call you students because you're all my group, right? So congratulations, Jackie. And thanks for coming back and joining us today. Wangari says hello. Denise says hi. Vicky says I hear you. Thank you, Vicky. Fred says hello. Wangari says yes, we hear you. Jose, hello. Joey, hey Joey, welcome back. Theana says hello. Vivian, good afternoon. Alliance, oh, I like that name. Alliance says hi. And Vivian says, thank you so much for your tips. I passed my skills exam. Congratulations. That is awesome. Oh, we're so excited for you. Congratulations. Thanks for coming back and telling us. You guys have no idea how much that pumps me up. I mean, I really, really appreciate it when people use our resources and then come back and tell me that they were successful. And it, you know, because I'm back here in my little office and typing my little fingers off and creating graphics and programs and all kinds of stuff. But it's nice for me to be able to hear from you that you're finding these things helpful. And I love to hear from my tribe. So congratulations, Vivian. Blue says hello, afternoon. Crow's Nest, hey. Blue says, when I worked in a nursing home, I'd often see CNAs change their gloves without washing their hands. It drove me crazy and made me so twitchy. Oh, Blue, I'll have to tell you guys about that. I have a whole lesson I do on this, on glove use. And if you've watched my classroom sessions, you probably saw it. But I have a whole presentation on this. And I'll talk to you guys about glove use in an upcoming episode coming up. But gloves without hand washing is actually way, way more dangerous for the caregiver than you realize. And we'll talk about that in an upcoming episode. Wins says, today is my board exam. I hope I can make it. Oh, Wins, we're going to keep our fingers crossed and send out great vibes to you. And we hope you do fantastic. And when you do, please go to my YouTube channel. Find any video, it doesn't matter which one, just leave me a fresh comment. Let me know that you passed so we can congratulate you on an upcoming episode, because that's actually my favorite part of what I do. I get to send congratulations out to all the people that let us know that week that they passed the state exam. And guys, we're getting really close to having to have a second page of congratulations because so many of you guys now are letting us know, and that couldn't make my heart any happier. I'm hoping to get to 10 pages of people that we can congratulate on a weekly basis. We need you. So Blue says, in Washington State at Harborview, which is a level 1 trauma center, a patient with a chest tube, an RN was doing management on it, and the patient ended up with a severe case of pneumonia and later died. Investigation by the Department of Health, the RN forgot to change her gloves and wash her hands between a couple of the steps. And that simple oops is how the patient got so sick. That hurts my heart in so many ways. And it's inexcusable. But to me, it really is. I mean, it is totally inexcusable. However, I want you guys to remember that you are only as good as your instructor. And if this nurse did not have a good instructor that explained the why behind it, the reason why, you know, washing your hands and changing your gloves at that critical moment, that step between dirty and clean. If they didn't truly understand the chain of infection and all of that, then the importance of that step may have been lost on them. And ultimately the patient paid with their life. And that's, help isn't help if it's not helping, right? So we really have to understand what we're doing, because we literally hold the patient's life and death in our hands. That is an extreme responsibility. and going into this with the right mentality and not learning enough just to pass the test, but learning it so it becomes a part of us, so that when we're caring for those patients, we understand that is somebody's loved one. That is a human being that deserves our respect and our adherence to the principles that we've learned. That these steps are not just for the test, that they actually mean something, and there's a reason behind them. And there's a reason why when we start working in the workplace, we shouldn't just throw everything we learned out the window. The reason we learned it is because it has an importance. And this is one of those steps that, you know, a lot of people, they're like, oh yeah, I know, you don't hold it against your uniform, no big deal, yada, yada, yada. But yet when I was in a facility not too long ago, I saw at least 3 direct caregivers walking in a hallway holding things right up against their uniform. So I know that when we go from classroom to clinical, right, when we start developing our own clinical habits and routines, sometimes those classroom lessons can be lost. And if we're not reinforcing them and explaining the why and reminding caregivers why these steps need to be adhered to, then we may not get good compliance. And ultimately, it's the patient that's going to suffer with that. Now, I read an article today on this. And the way the article was written, I just kind of wanted to pull my hair out. So this article was about eye drops. And there is a certain eye drop that has been recalled. It's actually made by 2 different manufacturers. It's been recalled, but it was sold at a lot of really big stores in the area. And you can, you know, search on a search engine for this. I'm not going to tell you the names or anything. But there was an eye drop that was recalled, and it has affected 68 people in like 16 states. Now, out of that, 5 people have lost eyes. 1 person lost their life. Now, can you imagine? Right? You got dry eyes, maybe you have some allergies, maybe something's going on, you got this over-the-counter eye drop, you squirt it in, and a couple weeks later, you lose your eye. A lot of people have lost vision. And to me, I think that's just as bad as losing your eye, because even though it might still be there, it's not working. And that affects your ability to work, to drive, to maintain independent care, to interact with your family. I mean, losing your vision is a really big deal. Really big deal. So this isn't something to be taken lightly. But in the article, so that's a whole nother conversation, but in the article, it said that it was being caused by a very specific bacteria. It's a strain of Pseudomonas that is resistant to most of the antibiotics that we use. Now, we do have one that we're using against it, and it's showing some effect, but not great. And that's a really scary thing. You know, we have this bacteria that is killing people and taking their vision and causing them to lose their eyes. Because, guys, your eyes are like right there at your brain, right? It doesn't take much to go from your eye to your brain, and now we've got a real problem. But this pathogen, this Pseudomonas pathogen, we don't have a whole lot of artillery in the back closet we can use against it. So the real problem is that most of the cases they've found is spread within a facility, right? Multiple facilities, but this is being spread by direct caregivers, by CNAs. You go in and you help a patient with eye drops, or you help them with washing their face, or whatever the case may be, and you don't wash your hands when you leave that room and you go take care of another patient somewhere else, you can spread that Pseudomonas infection that, remember, we don't have much artillery against, from this patient over here to this patient over here. And the problem is that this is a low-level infection that simmers. So we don't see a lot of effects of it right away. We don't even know the patient has the infection. There's no signs. There's no symptoms. It's an infection that's in there. It's percolating, but it's able to be spread. So we are spreading the infection from this person to this person because we are not using good infection control techniques. Now, this is a really, really, really big topic. And it's one that I can't cover completely in the 45 minutes we have together. So we're going to start with little nuggets, right? So one of the little nuggets in preventing the spread of infection from one person to another is to make sure that you understand your uniform is not considered clean, and we don't want to hold things up against it, dirty things or clean things. I hope that helps you guys. I hope you find these interesting. So let's see here. Diora, hello. Alliance says, I have my skills test and written on Tuesday and Wednesday. Oh, Alliance. We're going to send you out good vibes. Good vibes for Alliance. You're going to do fantastic. If you haven't already, go to my website and download my ebook. It's free. It's easy. Just it's right at the top of my main page, foryourcna.com. In fact, I'll put it in the chat for you. It's foryourcna.com ebook. So foryourcna.com/EBOOK. There it is. So foryourcna.com/ebook. Go download that. It will help you on the written test. Go watch my animated lessons and my skills videos. It'll help you on the skills test as well. So let's see here. I feel so, let's see, TRX2. I take my written test tomorrow. Oh, TRX2, go get my ebook now. Spend the next couple hours reading it. It'll help you tremendously. Wynn says, I feel so nervous, but I have to conquer my fear. Thank you for your video. It helps a lot. Well, thank you, Wins. We want you to conquer your fear, and we want you to do well. More importantly, we want you to take excellent care of those patients once you get certified, and we're here to help with that as well. So our good vibes out to you. Remember to focus on the patient. It's always about the patient. Everything is always about the patient, including the test. Let us know how you do. Natu says, right, help is healthy. Dior says, I hope we'll come back. I keep watching your video. And Nato says, right, so it will be part of our work nature. Yes, absolutely. You got it. Blue says, thankfully the RN hasn't lost her job and she feels horrible, and it's a teaching experience for everyone. And Harbor View is going to use it as a lesson of reminding everyone the why we stop, wash hands, change gloves at a certain point before moving on and finishing the task. Absolutely, Blue. Absolutely. And I agree. This should be a learning opportunity. I don't believe in persecution, in serious discipline. If it's a mistake that was made because of lack of awareness, training, or understanding, that's a teachable moment. Now, if it's something that's being done out of malice or a break in protocol, now that we have to look at a little bit differently. And that's why there's ethics committees and supervisors and administration, because they are going to look at the whole situation and figure out how best to handle it. But that makes me feel good that they're using it as a training opportunity. Let's see here. Yes, infection control cycle. Omar says, Miss Laramie, what would be your best advice for people that are starting their nursing career? Blessings to you, and thank you for your videos. Omar, so I've got a lot of advice. Just ask me. So for people that are just starting their nursing career, but a lot of it has to do with what type of nursing do you want to get into? And I've got a quiz for this. I actually have a workplace personality quiz on my website. Go to foryourcna.com. It's called Your Ideal Workplace. Go take the quiz and it will help you. It gives you a whole big synopsis of the setting that it matched you to. Go through and look at some of the other settings too. But the advice that I would give you is to make sure that you truly understand that your personality is going to impact how happy you are in the workplace you choose to work in. And that's where that workplace personality quiz is going to help you. It'll help you narrow down your personality quirks and match you with the right workplace for it. Because even though a lot of people want to go to work at a hospital, it's not that you may not have the personality and the temperament to thrive in the hospital. And I'd hate to see you leave healthcare altogether because you did nursing in the wrong workplace, right? It's the wrong workplace, not the wrong work. So having the ability to understand that, that if you're not happy where you are, try a different type of nursing rather than leaving it all together. That would be my best piece of advice for you. Jennifer, you're here. You're late, but you're here, and that's what counts. So welcome. And then Mai is my heart. I absolutely love her. She is my assistant, and I cannot live without her. She just put the link for your ideal workplace in the chat for you guys. And Natal says it's about preventing the spread of disease and keeping things healthy and as sanitary as possible. Yes, absolutely, Natal. Fred, when is my next live class? My next live class starts on March 27th, which is a week from Monday. So I graduated a class out yesterday. I have a week off. I've got a lot of things I've got to get done in that time frame. I'm working on the live quiz show. Oh, I didn't bring it in. I forgot to bring it in. I got some prizes. So that live quiz show, we're actually giving away prizes when you win it. So for the top 3, the people that score in the top 3, we're going to be sending out prizes. And one of the prizes I just got shipped to me, and I'm so excited. So stay tuned. I'll show you in an upcoming episode. But I'll be working on that over the next week. I've also got I'm going to be the guest celebrity or the celebrity guest at HOSA Florida State Conference coming up in a couple of weeks that I have to get ready for. That's a whole lot of fun for me. And I've got some other things, but this next week is just going to be jam-packed with things I've got to get done. And then my next class, my live class, will start on Monday, March 27th from 9 to 1 Eastern Time for 4 weeks. I hope you guys will feel free to join us. Even if you're certified, it's always a lot of fun to see what's being taught, how people are being taught, and to be able to interact with others. So join us if you can. So let's see here. Let's get to who passed. So today, like I said, do you see how big this list is now? I'm going to have to go to 2 pages here shortly, which makes my heart so happy, so happy. So let's go ahead and congratulate Treasure Adesian, Victor Harris, Nanda Halundi. I hope I'm not butchering these. If I are, my sincerest apologies. Allegress Pauline, Tia Verstig, Anthony Carter, ISTEFJC, and Christella Romulus Blanchard. We congratulate all of you. Great job. Fantastic. Welcome to the wonderful world of healthcare. And we're so happy that you allowed us to be part of your journey. We are so incredibly grateful to all of you. Now, Gwendolyn David is testing soon and came by our channel to let us know. So let's all send some positive vibes out to Gwendolyn as well as she gets ready to test. So if you're watching, great success to you. Lots of positive vibes. Stop by and let us know how you do so we can congratulate you on an upcoming episode. And all of those that we've talked about up till now that have let us know that they're getting ready to test, great vibes out to you as well. You're going to do fantastic. I believe in you. So let's see here. Wynn says, how do you lessen nervousness, Miss Patti, when the evaluator is watching you? That's a great question, Wins, and it's one that comes up a lot, actually. I do this for a living, right? I am really, really good at these skills. I can do these skills with my eyes closed, one hand tied behind my back, because I do them for a living. But if I had to go to the test tomorrow and I had to perform these skills in front of somebody that was watching my every move, my nerves would be really high too. I get it. I do. But I want you to think about this when you're testing, okay? And this is kind of a hard thing. So be prepared for some hard work here. When you go into the test, I want you to look at the person playing the patient or the mannequin, and I want you to focus all of your attention there. Because the test really isn't about you. The test is about the patient. And if you can make that little change in your brain, if you can remember that the evaluator is paying attention to the patient, not so much to you. It's about the patient. So when they're watching you wash your hands, it's not about you. It's about, are you getting your hands clean enough for the patient, right? When you're ambulating with a gait belt and you're putting the gait belt on, you're thinking about, okay, well, it can't be twisted and it's got to be snug enough, and you're thinking about all the little steps, but that evaluator is looking at it differently. The evaluator is thinking to themselves, is that gait belt tight enough? Because if not, the patient can slip out. Is that gait belt twisted? Because if it is, it can injure the patient, cause bruising. Is the CNA positioned properly to assist the patient to stand so the patient doesn't get injured, right? So their focus, all of those steps they're grading you on, always go back to the patient. And if you can remember that, if you can focus on the patient, that will naturally reduce your nerves. But on the other side of this, they know you're nervous. There isn't a single person that's testing that's not nervous. They know you're nervous, and it's okay. It's perfectly okay to stumble a little bit on what you're saying, to have to think about your words, to have to restate something a couple of times. It's okay. They're not grading you on that. That comfort will come with practice. Over time, with experience. They know you're going to be nervous. They don't grade on that. They're grading you on how the patient is kept safe and informed and comfortable, and that the task is being done appropriately for their well-being. That's what they're looking at here. I hope that helps. Natalia says, you will pass the test, and I absolutely agree. Wendy, hey Wendy. Wendy says, when I went for my skills part of the test, I was so very nervous, but then the instructor informed me that everything was going to be okay, just do my best, and I passed it the first time. Congratulations, Wendy. Natalia says, you can't think if I'm doing it right or nicely. It's about proper technique and skill. Yeah, it is about proper technique and skill, but it really, really boils down to the patient. The proper technique and skill is all a tool to take proper care of the patient, but at the bottom of everything, it's about the patient. Fred says, I passed. Congratulations. Oh, that's so awesome. You guys uplift me. I can't thank you enough for tuning in each week and giving my heart a boost. I hope I do the same for you. And if you like today's episode, feel free to give me a thumbs up. I'd love that. If you haven't subscribed, now would be a great time so you don't miss any upcoming content. And I'm going to give you guys a little secret. I'm actually learning how to create reels and shorts. So you're going to see a whole lot more content from me coming up very shortly in short form. So I'm just going to give you like little snippets and tidbits and testing tips and tricks and things to remember. And but I'm going to be starting on reels and shorts and short form video. So if you have subscribed to me, you'll be getting notifications. If you haven't, do me a favor and subscribe. And when you see those, give me a thumbs up if I'm on the right track, if you like the content that I'm producing, so that I know that, you know, as I learn how to do this, because guys, remember, I'm technology challenged. As I learn how to do this, I can respond to your needs. So when you see these coming up, let me know what you think about it so I know how to tailor it for you guys. And feel free to follow us on social media as well, because we're going to be posting a lot of this type of content on social media. Now, for instructors that might be catching this on the instructor side, I have a brand new CNA group that we just created, but it's only for instructors, and it's called CNA Instructor Secrets by For Your CNA. So if you're an instructor, make sure you take a look and see if it's going to be something that can help you, because on that channel, I'm going to be producing content and lessons and resources specific to instructors to help you guys out as well. So if you haven't found us on social media yet, give us a try. And let's see here. Omar says it's going to be awesome. Jennifer says, do you know how long CNAs have been around? Yeah, CNAs have been around in some capacity as long as nursing has been in existence. But the term CNA, I believe, was, if I remember correctly, I'll have to do some research on this, but I'm pretty sure it was in the 1950s that nursing assistants became a recognized industry. And the certification part came about, I believe, after 1992 or 6, was OBRA that required certification for certain workplaces. But that's a very interesting question. I hadn't really thought about that, and I'm having to really stretch my brain here to remember what I've learned in the past. I'll have to look into that and do a lesson on that. That would be a really good lesson on the history. So thank you, Jennifer, for suggesting that. And yes, Joey, my plaque is right behind me. Let me see. Let me go this way. There it is. There's my YouTube plaque, and that's your YouTube plaque because you guys all made that happen. So that's your plaque. You guys are awesome. Let's see here. Natal says, I love your lives and channel. Thank you. And Wynn says, thank you, Miss Patti, for your words. 3 hours before my test, it helps me to calm. Wynn, I'm going to keep you in my thoughts, and I'm going to send out good vibes over the next 3 hours, but I can tell you, you've got this. Bettina says, I passed last year, but I'm still like to come and learn more. Oh, thank you, Bettina. We really appreciate you. And Maria says, hi, Miss Patti. Happy Thursday. Happy Thursday to you, too. All right, guys, we're at the end of our time together, and my heart is sad, but I hope I was able to fill yours with happiness and smiles and allow you to spread some cheer to others as you go about the rest of your week. Do something fun this weekend. I'm going to have a family gathering on Sunday with my immediate family, my mom and my kids, and we're going to celebrate birthdays. So my oldest son's birthday, my youngest son's birthday is this month, my dad's birthday was this month, and he's no longer with us, but we're still going to celebrate the wonderful day that he was born because it is a very important day in my life. And anniversaries, both my mom and dad's anniversary was a couple of weeks ago, and mine is coming up at the end of the month. So it's going to be a really big day of celebration, and I'm super excited to be able to do that this Sunday. So go do something fun. And I have a brand new puppy that's coming to my home next weekend, so I'm getting ready for that as well. So lots of really good things on our horizons, and we do love having each and every one of you in our lives as well. So I hope you guys have a fantastic day, and I will see you this time next week on Thursday, and I'll give you some information about the upcoming game show we're going to be starting very soon. All right, guys, until next time, happy caregiving. Bye.